समय पर आ गए हैं और यहाँ हमारे साथ उपस्थित हैं। एक एक करके मेरे सब दोस्त यहाँ आ रहे हैं। दिल में ख्याल आ रहा है कि एक एक करके हुए जाते हैं तारे रोशन, मेरी मंजिल की तरफ तेरे कदमों के निशान आते हैं। शुक्रिया, तालियां अपने लिए बजाइए प्लीज़। आप लोग सब समय पर यहाँ आ गए हैं और आज हम अपने सेल्फ एडवोकेट्स के, अपने बच्चों के इन खूबसूरत दिनों को यहाँ इस तरह सेलिब्रेट कर रहे हैं, इस तरह जश्न मना रहे हैं अपने बच्चों के इस दुनिया में होने का। ये बहुत बड़ी बात है। मुझे नहीं लगता 40 साल पहले जब रेखा माँ बबली को गोद में लेके किसी दिन कहीं चेन्नई में बैठी होंगी, उन्होंने ये सोचा भी होगा कि एक दिन ऐसा भी आएगा। तो हम लोग बहुत खुशकिस्मत हैं, अपने आप को लकी मानिए कि रेखा माँ की वजह से आज हम लोग यहाँ अपने बच्चों का जश्न मना रहे हैं दुनिया के सामने। यस बिल्कुल। एक एक करके हुए जाते हैं तारे रोशन, मेरी मंजिल की तरफ तेरे कदमों के निशान आते हैं। एक आपके लिए ही हो जाता है रेखा माँ। रेखा माँ के लिए क्या कहूँ, हम ये कहेंगे कि मुझे जो भी मिला है तेरे दर से मिला है, मेरे सर को ये रुतबा तेरे दर से मिला है, हालांकि मुझे ये सर भी तेरे दर से मिला है।
Hello.
On that stage, honestly, don't you think they are the best MCs in the world? Put your hands together for Sammy and Parul. Whenever somebody praises me, I have to give it back, no? Yeah.
Oh, this was business.
हमारे डॉक्टर्स के लिए, मेरी दोस्त समीक्षा जब तक आए तब तक मैं कहती हूँ अपने डॉक्टर्स के लिए बुरा तो नहीं माने। उनके देखे से जो आ जाती है मुंह पे रौनक, वो समझते हैं बीमार का हाल अच्छा है। आपके लिए
So we have Dr. Nidhi on stage with all the other doctors to translate what Parul just said. So as we wait for other participants, all our delegates to join us in the hall, we would like to request our doctors who are in today's panel to please take their seat on stage. So we will like to call upon Dr. Pradeep. He's a geneticist. I hope, sir, you are around. Yeah. So we request Dr. Preeti Singh Rekhi. We request Dr. Prakash Vemingal, Dr. Jayashri Gopal, Dr. Nidhi Gupta, Dr. R. Sankar, and Dr. N. Rangarajan to please come and take your seat on the dais. And Dr. Manish Grover, sir, you are here, I believe. Please come and take the stage. Thank you so much for joining our panel today. Yeah, put your hands together. Come on, lazy. You had a lot of breakfast, huh? Them also. No? So
अभी का जो ये सेशन है ये सब YouTube पर ऑनलाइन होगा, तो आप अपने दोस्तों को, घर वालों को, फ्रेंड्स को बताना चाहते हैं डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के YouTube चैनल पर हम ऑनलाइन हैं, तो आप बताना चाहते हैं तो वो देख सकते हैं, ठीक है। और आप ही इसे बाद में देख सकते हैं, रिकॉर्डेड रहेगा लाइव। थैंक यू।
like always, me and Parul live on DSFI channel, either YouTube or Facebook, but today we are on YouTube. So if you would like to share that information, those friends also of yours who are sharing the same venue and the same IIDSC, please share with them so that they come back and join us as soon as they can. For those who have difficulty understanding English, we have Parul to translate. So after every speaker speaks in journal, she is going to conclude in Hindi for all of them, those who don't understand English. Yeah. So good morning once again, everyone. So we start while we wait for others also to join. So the question is not how to get rid of fear, but how to awaken the intelligence with which to face and to understand and go beyond fear. Hope you all had a very comfortable night at the palace, and today all set to learn, unlearn, and relearn, and earn a lot of wisdom to be able to understand and manage all the medical issues which comes along with the diagnosis of the Down syndrome. And for that, giving that befitting start for today's medical panel discussion, we have the most empowered and independent self-advocate with us. This young lady follows a very busy daily schedule and a demanding job which requires hours of standing and a lot of physical work, and that follows that taxing regime 6 days a week, and it is 8 to 9 hours of job daily. And that too with the biggest smile on her face. Today, she is going to share with us her secrets of healthier, fitter, and happier life. Please put your hands together for our two-time international national awardee and lots of trophies and recognition to her credit, which is multiplying each passing year. For Miss Devanshi Joshi.
Hello everyone. Namaste. I am going to talk about health. Lord, I mean health. I know you are smiling because I am chubby. Many of you are also chubby. My mother and father are also chubby. But we are healthy. By grace of God, we don't take many medicines and we will very happy. That is important. So we are already safely chubby. That is why I am going to talk about health. Once we take care of our health, we can enjoy life and we feel happy. I get up at 6 a.m. every day, sometimes at 6:30 a.m. except on off days when I get up in the afternoon. Then I make my bed. I like to keep my bed and my room very neat and clean. It makes me feel good. I also do some self-talk. It motivates me. I set my targets every day. Nobody else knows what they are, but that doesn't matter. It makes me feel confident and cheerful. That is what matters. So, we should get up early and make our bed. We should also decide our agenda for the day. I try to do some exercise before going to work. I do it few times every week or maybe few times in a month. I don't remember, but I walk a lot in my job. I also do a lot of physical activity at work. Physical activity keeps us fit and fine throughout the day. It also ensures sound sleep, which is the best medicine. I take heavy breakfast before going to work. Breakfast gives me energy. I need lot of energy on my job. I eat different dishes every day, which my mother prepared for me. I also eat seasonal fruits and dry fruits. They make me feel good and boost my immunity. I take my lunch late in the afternoon. I also eat at work, but only once. I don't eat snacks in the afternoon. We should avoid eating between meals. Otherwise, we become chubbier and our tummies get bigger. I smile a lot while having my lunch and chit-chat with my team. This helps me digest my food easily. Eating in groups makes you feel good. I also have to digest food better. I do video calling during my break with my friends. I share my experience with them and inquire about them. It makes me feel happy and connected. I do not feel lonely at all. When we talk to our friends and relatives, we feel good and relaxed. While returning from my work, I listen to my favorite songs when my father or mother are taking me home. Many times I sing along. My tiredness goes away and I feel charged. We must use some time to ourselves to enjoy. Otherwise, we'll feel tired and angry all the time. When I reach home, I check out WhatsApp messages and send replies. Sometimes I do Insta reels. When people appreciate them, I feel very good. I also laughed a lot. I make few phone calls to my friends and aunties. I inquire about them. Sometimes I complain about my mother or father to them. When we share our joys and sorrows with others, we feel connected. Sometimes my parents pick me up in the evening from my job and we go somewhere directly. Sometimes we attend weddings or birthday parties or other events. It makes me very happy because of the supplies. Supplies make life exciting. If we do something suddenly without planning, it makes us feel good. We sometimes go out of town. We visit new places. It is a nice change from routine. It charges my practice. We take a break from out of routine. It doesn't always cost a lot of money. I love my job. I enjoy working and meeting new people every day. It gives me a sense of purpose. We must find out what we like to do and try to follow a routine. It gives us direction and focus. If we like our work, we don't feel stressed. It improves our health. That is why I don't feel tired in the evening. Later, I look forward to joining my work next day. I have traveled a lot. I have also visited few countries. I have done high altitude trekking. Next month, I will be going with my friends to a trekking camp in the Himalayas. If we try to do something adventurous in life, once in a while, it boosts our body and mind. We must remember to eat well, sleep well, and do some exercise. We must laugh a lot and relax. We must connect with others and find a purpose in life. It will make us healthy and happy. Then we feel blessed. So, let us decide right now to take care of our health. When we meet in the IIDSC next year, all of us should be healthier, physically and mentally fit, and the most important, happier. Our life is a gift. Let us enjoy it fully. Thank you. Love you.
तालियां कम रही बच्ची ने जितनी मेहनत की है। और मैं आपको बता दूं, जो लोग हमारे दोस्त आज पहली बार देवांशी को सुन रहे होंगे और देवांशी के बारे में नहीं जानते हैं, देवांशी जो है अपने मम्मी पापा की इकलौती बेटी तो है ही, प्यारी तो है ही, लेकिन वो एक सिर्फ कमाऊ हाथ वो ही है घर में, उसके मम्मी पापा कुछ नहीं करते हैं। और और दिवांशी ने, अगर आप उसके एजुकेशन के बारे में बात करेंगे तो 12th किया था NIUS से, ओपन जो स्कूल होता है वहाँ से, और उसके बाद ग्राम भारत में भी कितने साल काम किया था दिवांशी? हाँ
5 months ने किया मैंने।
हाँ, और ग्राम भारत करके एक स्टोर होता है, जैसे ये खादी के या इस तरह के होते हैं, बड़ा अच्छा सा स्टोर होता है, वहाँ पे इसने पूरा मैनेजमेंट संभाला और इतना फेवरेट वहाँ पे सबकी ये हो गई थी कि सबको ये लगता था कि नहीं, मैं नहीं हूँ छुट्टी में या मैं कहीं जा रहा हूँ तो मेरी डेस्क दिवांशी ही संभाले। और अभी भी रिलायंस में तो वो ये नहीं कहती कि मैं रिलायंस के लिए काम करती हूँ, वो कहती मैं मुकेश अंबानी के लिए काम करती हूँ। हाँ है ना? हाँ तो आप में से देखिए कौन कौन है जो मुकेश अंबानी के लिए काम करते हैं। हाँ।
Yes, true, Rekha Ma. That was a very, very inspiring speech by Devanshi. And as always, you have given me many personal goals. And I'm trying to be fitter and happier with you. She has been working from the last more than almost a decade. And today she is working in the retail of the biggest corporate of India and has already become an icon in that house also. Thank you, Devanshi. So now we have our experts here from the different medical areas who are going to share their knowledge, their experience to benefit us all. For giving better care to our champs, we have with us Dr. Pradeep, who is going to moderate the session. And believe you all me, those people sitting on stage, if we start reading their biodata or their accolades or the publication and the research and the awards credited to their name, we will end up the IIDSC by just sharing that. So we asked Dr. Pradeep to come and moderate the session, and I don't think so they require any introduction. We all know them. Can we give them a big round of applause for taking that effort and time for us? So Dr. Pradeep, over to you.
Thank you. Dear Rekha ma'am and the organizers of this wonderful conference, dear parents and my dear wonderful, beautiful children, good morning to all. Again, it's a great pleasure to meeting you all again in this conference. Last year we were there with you all in Raipur, and you never fail to inspire us. Yeah, the way the conference is conducted, the way you participate, it's really inspiring for us too. And with me, there are distinguished panelists. Dr. Reiki, he's an ophthalmologist specialist, and he is going to give us his views about the follow-up of vision of children with Down syndrome. Dr. Prakash, he's a pediatrician neonatologist, and Dr. Jayashree Gopal, she's an endocrinologist. Dr. Shankar, orthopedician. Dr. Monish, he's an ENT surgeon. Dr. Nidhi, she's a dental surgeon. And Dr. Rangarajan sir, he's a psychiatrist. I'm a pediatrician and a genetic consultant. So what this panel indirectly means to you, it is not going to be a didactic lecture. We will be talking and you'll be hearing and going. It should be an interactive session. What this stage conveys to you indirectly, what is the message you get from all these? We are all sitting, no? Okay. Okay. Yeah. Great. That is our duty. That's our pleasure to be there for you. What more? Yeah, this is an opportunity. You can talk to us. Okay. But for the issue, what we are dealing with, children with Down syndrome. So what does it convey? That we are going to give, definitely, that we are going to give. What is it indirectly conveying? All these are direct messages we are giving to you. So what is it indirectly conveying to you? It takes a whole hospital So maybe we need multi-speciality team to address the issues of children with Down syndrome. That is what it conveys. We all are needed. We are all from different specialties. Not that one doctor is going to give all the answers to your child. That is what it indirectly conveys to you. So I will start with the pivotal point. The pediatrician, Dr. Prakash sir, he is a neonatologist pediatrician from Rainbow Children Hospital, Bangalore. So I will start with him. Sir, so you will be seeing the child first, or you will be following up the child first. So my first question to you is, what and all has to be taken care of? What advice you will give first for these children? How will you follow up? What are all the tests and follow-up checkups these children need?
Good morning, one and all. I would like to thank DFSI for giving us an opportunity to be here once again. Wonderful to see you all, a great occasion, and I would like to thank Dr. Rekha for having us today. So, generally when you have a child with Down syndrome, when a diagnosis is made within the first few days to few weeks, most of the parents will probably take a week or maybe sometimes a couple of months to get this diagnosis get into their mind. And the main problem here is what we face on day-to-day practice is they just somehow don't try to come up for follow-ups, most of them. Few of them would like to have a lot of answers and questions which they would like to ask us. And that occasion probably we need to kind of hold their hand. That is the most important thing which a general pediatrician should try to understand about their concerns and try to address those questions initially rather than making a big conclusions and big statement. The reason is if you leave them alone, they would probably lose their follow-ups over the time, and we might miss the important crucial things which a child would probably be benefited in long term. So on that context, I would like to request all the parents over here to see your pediatrician and take it forward. And if a pediatrician is not sure how he can look into this aspect, probably he can refer to other pediatrician who probably can take the subsequent checkups as the child grows. The most important thing is a regular follow-up, and we generally see these babies during the first week to make a basic understanding and do the basic workup. The most important thing when a child is being diagnosed is to do initial blood investigations, a simple blood investigation like a complete blood count to see how the hemoglobin is, how the white cell blood count is, what are the platelet count. Then also we would evaluate the heart condition if the child has any heart issues. So we do a screening echocardiography which will tell us if their child has any heart issues. And the next thing, important thing is to establish feeding and to make sure that all babies who are born with Down syndrome should be able to breastfeed and there shouldn't be any difficulties. We might face some challenges initially, so that has to be initiated. And most of the hospitals have a lactation consultant working throughout, and we need to take help and establish the breastfeeding. Breastfeeding is very important, and that is the most important thing you need to do. And having said that, there are initial screening tests for the newborns. Nowadays, most of the hospitals have neonatal screening tests as a simple blood test, which should detect some of the other metabolic conditions if there is any association. And one of the most important thing we would screen is the TSH, that is the thyroid levels in these babies. So these are the most important things initially to start with, and obviously we would ask these mothers to bring their baby during the next 2 weeks to see if there is any ongoing issues. And during that time probably we would introduce some of the key subspecialties, because we know that early intervention is very good for these babies and they would do wonders, as you all have seen over the last yesterday night as well as in the morning, that how these kids, if you support them in all aspects of their development, they do wonders. So this is what I would start with and then go further.
Thank you. You can translate.
जी डॉक्टर कह रहे हैं कि आमतौर पर डाउन सिंड्रोम से प्रभावित जो बच्चे होते हैं उनको हम पहले हफ्ते में जांच करना चाहते हैं कि हम पहले हफ्ते में ही जान पाएँ कि कोई हृदय से संबंधित रोग तो उन्हें नहीं है, थायराइड वगैरह की जांच हम करना चाहते हैं और आमतौर पर पहले हफ्ते में ही हम जान जाते हैं कि वो डाउन सिंड्रोम से प्रभावित बच्चा है। उसके बाद हम उसको फर्दर जांच के लिए भेजना चाहते हैं और जितना अच्छा है कि शुरू का जो समय है उसी में बच्चे की जांचें हो जाएं और उसी में उसके लिए कार्य करना हम शुरू कर दें तो उतना ही ये अच्छा रहता है।
Okay, thank you. So, as Dr. Prakash has enumerated, we need to do so many follow-up investigations, and accordingly, wherever the issue is, we are going to meet the doctor, the specialist, accordingly. He was, yes, ma'am.
If you ask me, if you are a general pediatrician, I would love to see them till 18 years, 16 to 18 years, till they get into adolescent phase where they have moved from a childhood, clinics to adolescent Downs clinic. So I don't have any problem, but a lot of pediatricians, even if a general pediatrician, if you are not seeing Down syndrome, probably they would, in India, probably up to 14, 15 years they see.
For,
Yeah, that's a big problem even in the big cities. What happens, if you ask me honestly, I've been practicing 25 years in Bangalore, still those 25-year-old kids do come to me. And if I have any concerns regarding adult where I can't understand, I will ask my general physician if he has any insights on that. But generally by then, most of the things are answered, only the endocrine part of it, the dental, the ophthalmology, and cardiology should be okay by then. We would have done a screening and we probably will be looking at pulmonary hypertension at that time. If they don't have pulmonary hypertension, if they don't have right ventricular failure, we are okay with that. Other important thing is if they are having obesity, probably they can have obstructive sleep apnea, so you require a sleep study as well as the respiratory physician at that time. These are the most important thing. And of course, our the more important part of it is as they grow, the neurological part of it and their depression, anxiety, and all will be addressed by the respective teams then.
I'll add a point to this. The thing is, there are numerically the cutoff is around 14 years. Most of the hospitals stop seeing them. Of course, adolescent consultants are there. They are not widely spread. Their services are not easily reachable. Most important thing is we cannot immediately shift them to an adult physician or an adolescent practitioner after 14. So these children are with us for past 14 years. We have grown them, we have seen them growing, we know their problems personally. It should be like weaning off our services. Slowly they have to get introduced to an adolescent physician or a adult physician. It won't happen within 1 or 2 days. It will take months to years. We will be carrying them. Same way they will be meeting the adolescent physician or an adult physician for quite some time till they get comfortable. Slowly we will hand over the medical issues to the adolescent physician or an adult physician, so that all the transfer will be very, very smooth. That is the basic idea. You cannot shift immediately. Give some time, make them go get introduced to the physician, let them also understand the problems the child has, and slowly we will shift this file to them over a period of time when they are comfortable.
डॉक्टर यहाँ बात कर रहे हैं कि जैसे ही बच्चा छोटा होता है तो उसके बाद से 14 साल की उम्र तक उसे हम बच्चों के डॉक्टर को दिखाते हैं, और उसके बाद एकदम से जब वो बच्चे को डॉक्टर उसकी समस्याओं को समझ रहे हैं, सारे हेल्थ इश्यूज़ को समझते हैं, तो एकदम से बड़ों के डॉक्टर को हम जब दिखाने जाते हैं फिजिशियन को, वो हृदय रोग संबंधी हो या किसी और विषय संबंधित, तो हम एकदम से नहीं करते हैं। दोनों डॉक्टर्स के साथ बात करके स्मूथली वो फाइल उनके पास जाती है, धीरे धीरे दोनों की सलाह लेते हुए शुरू के कुछ सालों में, तब जाके वो 17-18 की साल उम्र तक वयस्कों के डॉक्टर को दिखाना हम शुरू करते हैं। पीछे एक हाथ कोई उठा रहे हैं, समीक्षा उनको माइक दे सकते हैं हम अगर। जी आप पूछ सकते हैं, जी अभी पूछ सकते हैं।
Can I ask the question right now?
जी बिल्कुल अभी पूछ सकते हैं। Yes.
Madam, when my daughter was born, and when I go up for the checkup and for the sequences follow checkup, the doctor said that there are 3 stages. It is mild, moderate and severe retardation. So what is the clarification on that?
Okay, let's-
I've had a doctor who has said your child has got little Down syndrome. Now, I really don't know because they are coming from rural areas and it's very difficult when you say, I mean, how do you explain mild, moderate and severe to them? So, Prakash, you can just tell them a little.
Can I look at it from one different way? Down syndrome is Down syndrome. There's no little or no large or small or, Patiala or anything. Okay, so you have, yeah. Okay, the point is the level of intellectual retardation is what people keep talking about as mild, moderate, severe, profound and all that. That again you cannot make out when the child is born. Okay, you have the stigmata of the Downs on the face and the body. Well, in some children they may be pronounced, some children they may not be pronounced, but the idea is for a person, the doctor who eyeballs the child makes, hey, this is possibly a Down's child. That's all possible really. The mild, moderate, severe and all comes up as far as the developmental range goes. So let us not get confused as to what we do later. What we do initially, yeah.
Okay, sir. Thank you. Thanks a lot. Wonderful question, sir.
Yes.
So, thing is, as sir said, these are all subjective. Subjective classifications: mild, moderate, severe. We actually, physicians, treating practitioners, don't follow that. We look for the issues the child has. That's all. Issue 1, thyroid. Issue 2, learning issues. Issue 3, speech, delay in speech. All these are just issues. We don't classify them anymore. We don't usually classify also. Leave these terms. As parents also, we advise that only. Child has a issue and we have to target upon what are all the difficulties child has and how I'm going to get it right. Each child is unique. We all know that. So they will have unique problems and we just have to list it out and follow that, manage it. That is enough. Coming to the second question, mosaicism. So it opens the topic of genetics. So genetics is, we know it is a genetic disorder. Children with Down syndrome are born with an extra chromosomes. There are only 46 chromosomes expected in each cell inside the nucleus. There is an extra bit of chromosome inside, which is not going to help, which is going to bring down the functions of the cells. So because of that, again, the functions of the organs are affected. So they are relatively slow. The extra one chromosome is pulling down. The work is not done at the right time. We are giving some training, making them effective so that this issue is sorted out. So mosaic pattern is there will not be uniformly all the cells in the body which will have 47 chromosomes. There will be some normal cells also. Say percentage wise, it may be 60% normal cells, 40% mosaicism. So this may differ in organ to organ. Say in heart, it may be 100%. 0% of normal cells. In brain, it may be 90% of normal cells. In one child itself, the mosaicism pattern can vary. Based on that, the child may behave little better based on the mosaic pattern, the percentage of normal cells they have. The idea is 47 chromosomes in all the cells. Obviously, uniformly there will be delay. But some organs, they have normal cells also. Then those organs are going to behave better than the children with 47 chromosome. Mosaic, their performance will be better because there are normal cells inside the normal chromosomes inside the cells also.
डॉक्टर प्रदीप ने एक बहुत ही ख़ास बात यहाँ बताई है कि मोज़ाइक जो ट्रांसलोकेशन है जिसके बारे में अभी पूछा गया था कि ट्राइसोमी 21 होते हैं या फिर उसमें मोज़ाइक बोल देते हैं डॉक्टर कि ये कैसा होता है, तो जैसा कि उन्होंने बताया कि एक क्रोमोसोम एक्स्ट्रा होता है ट्राइसोमी 21 में, बाकी 47 में, हर एक में। तो होता क्या है कि हर एक सेल में वो एक क्रोमोसोम एक्स्ट्रा होता है, लेकिन अगर मोज़ाइक वाला डाउन सिंड्रोम ब्लेस्ड है बच्चा, तो उसमें कोई कोई सेल ऐसी होगी जिसमें वो एक्स्ट्रा क्रोमोसोम नहीं होगा। तो बॉडी के जिस भी पार्ट में हो, वो हृदय में हो सकता है, वो ब्रेन में हो सकता है, वो किसी और पार्ट में हो सकता है। अगर ऐसा कहीं भी होता है तो हम ये देखेंगे कि मुझे आप सही करेंगे डॉक्टर प्रदीप, अगर मैं कहूँ कि अगर हृदय में वो नहीं है या ब्रेन में वो नहीं है या स्पीच वाले पोर्शन में वो नहीं है, तो वो फंक्शन डाउन सिंड्रोम से अलग होंगे बच्चे के, वो नॉर्मल होंगे। जी हाँ, वो थोड़ा सा उस तरीके से होंगे। तो एक बॉडी के जिन सेल्स में मोज़ाइक में एक वो एक्स्ट्रा क्रोमोसोम नहीं होता है, तो वो मोज़ाइक डाउन सिंड्रोम बोला जाता है। थैंक यू। हाँ जी, हाँ
Okay, thank you. So I'll move on to the next panelist, Dr. Jayashree Gopal. She's an endocrinologist, Tapalo Hospital and Diabendo, India, Chennai. Ma'am, I've heard about Dr. Prakash saying thyroid testing, thyroid testing. Why thyroid testing, and how frequently we should follow up with the thyroid testing?
Yeah. Good morning, everyone. Always a pleasure to be here. And like was mentioned by the two speakers before me, you inspire us. So thank you very much. Both the parents and the children inspire us always. Why thyroid? So thyroid problems are very much more common in children with Down syndrome, anywhere between 10 to 30 times more common in children with Down syndrome. So this is the reason why testing for the thyroid regularly, and if we find it, treating it appropriately becomes so important for further optimizing the growth and development. So thyroid is a hormone that is necessary for normal working of every cell of your body, from your brain cell to your skin cell to your nails to your lungs, everything. Every cell in your body needs thyroid hormone. If the most common problem that we see with the thyroid and Down syndrome is an underactive thyroid gland, what we call, or sometimes doctors would refer to as hypothyroidism. That is, the gland is not making as much thyroid hormone as your body needs. This tends to be a particularly common problem in children with Down syndrome, which is why what we are recommending is below the age of 4 years, check your child for the thyroid levels at birth. All children are now recommended that we do universal screening. And thereafter, every 4 to 6 months till the age of 4 years. After that, at least yearly once, thyroid has to be checked. Even now, there are parts of the country, Rekha Madam was saying that there are parts of the country even now that people with Down syndrome do not have their thyroid checked. The symptoms of an underactive thyroid are things like tiredness, fatigue, body pain, joint pain, hair fall, skin dryness, constipation. These are all very common symptoms anyway with Down syndrome, and they tend to get worse because of this thyroid issue. If we can pick up a thyroid issue, and the treatment is very simple. We give a thyroid tablet, we are replacing something your body is not making. You have to continue to take that thyroid tablet regularly, do the blood test, make sure that you're taking the right dose. But if we keep the thyroid levels within the normal range, a lot of these symptoms that I was talking about, they do get better, and it also helps the child be more active. Sometimes I've had children come to me because the mother has observed that the child has become lethargic. Constipation has become worse, and we've picked up that there has been some thyroid fluctuation. So these are all common things that we see in children. It's a simple enough test to do and test. And if anyone has a child in this room in whom thyroid has not been checked, particularly in the last 1 year, please make sure that you ask your doctor and get it checked. So thyroid is a very common problem because of that reason.
Thank you, ma'am.
डॉक्टर जयश्री ने बताया कि हमें आपकी उपस्थिति हमेशा उत्साहित करती है और विकास के लिए एक हार्मोन की ज़रूरत होती है जिसे थायराइड बोलते हैं। इसमें मेन रूप से डाउन सिंड्रोम प्लस के साथ में हाइपोथायराइडिज्म की प्रॉब्लम ज़्यादा होती है, जिसका मतलब है कि जितनी ज़रूरत होती है उतना नहीं बनता है शरीर में। जांच के बाद उसका पता लगाया जा सकता है, उसके लिए एक सिंपल टैबलेट दी जाती है जिससे कि उसकी पूर्ति की जा सकती है। शुरुआत में 4 से 6 महीने के लिए और फिर साल में एक बार जांच कराना बहुत होता है। वो कह रही हैं कि उन्हें रेखा माँ ने बताया कि देश में कुछ लोग ऐसे भी हैं जिन्होंने ये जांच कभी भी नहीं कराई है। ये जांच कराना बहुत ज़रूरी है क्योंकि मुख्यतः डाउन सिंड्रोम ब्लेस बच्चों में ये पाया जाता है। इसके मुख्य लक्षण हैं, अगर ये नहीं है, पूरा नहीं बन रहा है तो स्किन की प्रॉब्लम होंगी, त्वचा की प्रॉब्लम होंगी, बाल गिरेंगे, थकान होगी, चक्कर आएंगे। इसके लिए एक टैबलेट दी जाती है और जिससे कि इसकी प्रॉब्लम को ख़त्म किया जा सकता है। तो ये जांच साल में एक बार ज़रूर करानी चाहिए। और अगर माएँ बच्चों को दूध पिला रही हैं और वो थायराइड की टैबलेट ले रही हैं तो उससे भी थायराइड ऊपर नीचे बच्चे में हो सकता है। तो अगर ऐसा है तो भी जाँच कराई जानी चाहिए। थैंक यू।
Thank you. So with that, I will move on to the next specialist, Dr. Rekhi. He is an optometrist, graduated from Shankar Nethralaya. He is associated with field of disabilities and Down syndrome past 30 years from Spectrum Eye Care, Chennai. Sir, what are the important milestones in development of vision and how important is regular follow-up for vision for children with Down syndrome?
Thank you. To start off with, thanks Rekha for calling us here, and I think all of us, I speak for everyone here when I say we come here to get inspired by you. Vision is an extremely important part of the learning process. Roughly about 83% of what we learn comes through our eyes. And the importance of vision assessment is 3 things: 6 months, 2.5 years, and every year after that. At least up to the time that the child is about 16 or so, or 17. The reason for this is, when we are born, our eyes don't know how to see. It's like the child is always sort of moving his hands, trying to figure out how to use his hands. In the very same way, the brain is trying to learn how to use the eyes. So there are different parts of the eyes and different functions of the eyes. So one of the first things that has to happen is what we call as fixation. That is, when I ask a child, look at something, the child's eyes have to point in that direction. So that is saying, that is straight ahead of me. Because relative to that, things are either above, below, left or right of it. Now we have 2 eyes, right? So you have to develop fixation in the left eye, fixation in the right eye. Then the child actually starts seeing double. And then both the eyes coordinate together and there is no squint. And then you start developing what is known as 3-dimensional vision, because the world is a 3-dimensional space. So 3D vision is what helps you catch a ball. 3D vision is what helps you go downstairs. 3D vision is what helps you pour water into a glass. 3D vision is what helps you put a pen in a cap this way. A child with one eye will cap a pen this way. A child with one eye will run up the stairs, but walk down the stairs holding onto the banister, assuming that mobility is not a problem. So, normally the textbooks say that by the 4th week, the child's fixation should start developing. I will say in many cases, especially when it comes to children with cerebral palsy, some children with DS, I'll wait even up to 4 months. Now, obviously, if I'm seeing a child who is not looking at all, then it's a different issue. But this is a rough guide. So, if you say, look at me, the child should be able to look at you and maintain that steady fixation. It's a simple test you can do at home. You do not need a doctor for this. The second is, by the time fixation is developed, by the 6th month, there should be no squint. Because if there is a squint, the child will either start using only one eye, or he will use one eye, or she will use one eye for one side of the field and the other eye. So if you've got crossed eyes like this eye will be used to see her, and this eye will be used to see here. And the brain just alternates between the 2 eyes. This has to start being corrected at this age. Quite often when we have a child who comes to us at the age of 14 and they've had a squint right from birth, if you straighten the eyes out, it can actually cause more problems. It is a cosmetic correction, but it does not give you functional improvement. That child has 2D vision. he or she will never develop 3D vision. Unless they have used both their eyes, even if it's for a couple of months in that first year of life, then yes, we can develop on it. But I cannot initiate the process. So to me, these are the landmarks. Fixation, which is very simple. Second is coordination of the eyes. So if you have a child who's squinting sometimes, towards the end of the day, I'm not bothered, we can handle this child later. But we need to tackle a lot of these problems. And if you start thinking of doing a surgery at 5, now that's a borderline age. We don't know whether the surgery is going to be successful, whether it's going to actually give us functional improvement. And you're going through the added risk of a surgery. One other simple test that you can do at home, and this can be done at any age, at any time. As a matter of fact, this can help you eliminate problems even at a later point in time. So let's assume that my right eye has got 60% vision, right? My left eye has got 90% vision. A lot of us have got this. So if I close this eye, I still see 90%, correct? But if I close this eye, my vision drops to 60. Even a 1-month-old baby will do this. So if it's not 100% of the time, so many times you put a hand in front, the child will say, what are you doing? So if, let's say, most of the time you put the hand in front of the right eye, which is the bad eye, it doesn't bother the child. But every time you cover the left eye, the child gets irritated. That's a definitive sign that this eye is not seeing as well. It's a simple test. You can do it on anybody, any age. You don't have to be a DS person for it. And it helps us a lot in trying to detect things at a little earlier age.
मुझे लगा था लास्ट टाइम की तरह डॉक्टर एक ही खुद ही करेंगे, लेकिन
मैं बोल देता हूँ। नहीं, हम क्या बोल रहे थे कि सबसे पहले जो डेवलपमेंट होता है वो है कि आँख को एक चीज़ को देखना पड़ता है। सबसे इम्पॉर्टेंट चीज़ वही होती है। तो एक आँख से आप एक चीज़ को देख रहे हो, दूसरी आँख से भी वही चीज़ को देखना पड़ता है। आँखों को स्टेडी होना चाहिए। वो दूसरी चीज़ें होती हैं जिसमें आँख हिलती है, that's called nystagmus, that is a different thing. I'm not talking about that. But if you say मेरी आँख मुझे देखिए, वो आँख आपको देखनी चाहिए, स्टेडी होनी चाहिए। हमारे पास 2 आँखें हैं, तो जब एक आँख देखती है, दूसरी आँख किसी और चीज़ को देखती है, हमें 2-2 नज़र आता है। और ब्रेन का ये फंक्शन होता है कि वो दोनों आइटम को सिंगल करे, एंड यू डेवलप व्हाट इज नोन एज बाइनोकुलर सिंगल विजन। ये 6 महीने के अंदर हो जाना चाहिए। तो ये जो स्टेडी फिक्सेशन होता है 4 हफ्ते से लेकर 4 महीने तक होना चाहिए, और दोनों आंखों में ये जो स्क्विंट हम बोलते हैं वो 6 महीने के बाद हर वक्त परमानेंट स्क्विंट नहीं रहना चाहिए। और इसके बाद में जो हम देखते हैं 2 साल 3 साल की उम्र के बाद में ये होता है कि एक आंख से नज़र अच्छी है, दूसरी आंख के नज़र अच्छी नहीं है। ये हमें 2.5 की उम्र से जितना जल्दी हम इसको करेक्शन कर सकते हैं वो विजन डेवलपमेंट हो जाता है। सिंपल थिंग आप सोचिए, एक आंख में +3 पावर है, दूसरे में 0 है। मैं सिर्फ इस आंख को इस्तेमाल करूँगा, इस आंख की नज़र कम हो जाती है, हमने इस्तेमाल ही नहीं की है। और ये 18 साल की उम्र में मैंने अगर वो +3 चश्मा लगाया, बच्चे की आंख का विजन नहीं आएगा, 2-3 लाइनें पड़ेगा, उससे ज़्यादा नहीं करेगा। इसको हम लेजी आई बोलते हैं, इसको एम्ब्लियोपिया बोलते हैं। इसको जितना जल्दी 2.5 इज अ क्रिटिकल एज।
We'll move on. Thank you, sir. We'll move on to the next specialist. Dr. Shankar, sir, is a pediatric orthopedic surgeon at Apollo Children Hospital, Chennai. Sir, why children get ortho issues? Children with Down syndrome, why they are predisposed to ortho issues? What are the common issues and how to prevent them?
When you look at a child with the Down syndrome, we see children presenting with a lot of foot problems, knee problems, and spine problems like scoliosis. All this is because of the extra gene causing the loose tissues and the ligamentous laxity. So joints are lax. So when the child walks, the child is a little bit clumsy when the child is walking around. We don't give that much importance to orthopedic issues because always we are concerned about improving the life expectancy, like concentrating their heart issues, eye issues, and other issues. But when you have, when we start seeing children living, the life expectancy has improved, like they are living like normal adults. So when we start seeing a lot of children going to adulthood, we end up seeing a lot of orthopedic issues, which we see in a normal adult as well. Like the common issues other than the ligamentous laxity causing a knock knees, foot issues, scoliosis, neck issues, We also end up seeing children presenting with a vitamin D deficiency, osteoporosis, because the child is not active, develop obesity. So all these issues has to be addressed for a child to have a better quality of life.
Thank you, sir.
हड्डियों के रोगों में, डाउन सिंड्रोम से ब्लेस्ड बच्चों में जोड़ों और रीढ़ की हड्डी के इशू हो सकते हैं, आँखों और हृदय के साथ साथ ही। जब बच्चे बड़े होते हैं तो हड्डियों के किसी रोग के साथ हम जब बच्चे को देखते हैं तो उसमें स्क्लेरोसिस, पैरों के इशू होते हैं, घुटने का इशू होता है, रीढ़ की हड्डी का इशू होता है। तो उससे समय रहते हम बदल सकते हैं। बहुत सारी चीज़ें हैं जिनके साथ हम इन इश्यूज़ को एड्रेस कर सकते हैं। कई बार विटामिन डी की भी डेफिशिएंसी होती है जिसे हम दवाई देने के साथ साथ पूरा कर सकते हैं।
Thank you. So we'll move on to the next specialist, Dr. Monish from SMS Medical College, Jaipur. He's an ENT surgeon. Sir, what are the common ENT problems we face with children with Down syndrome, and any preventive measures they can take? When should they come to you?
Perfect. Thank you. Thank you, Dr. Pradeep. And let me first of all, for half a minute, maybe tell you how amazing it feels to be here. And I'm telling you the reason why it feels amazing. I have never been a part of this forum. It's my first experience of this kind. The reason I'm telling you is because I am basically involved, being an ENT surgeon, I'm involved with children who are born deaf, right? I do take care of them a lot, and they require cochlear implants, and they need a lifelong support, right? And we lack this kind of an initiative for those children. So the first message which I think I would take out of this kind of a gathering is, take your help and start something like this, because they all keep coming to us individually, but when you two all get together, it's simply amazing. So thank you very much, for having me here. Now come to the topic which I have been asked. Now, if we talk of children with Down syndrome, one of the most common thing which is often missed is hearing loss again. So if you look at various studies and clinical experience which we have, approximately 50 to 70% of these children have some or the other kind of hearing loss. Now that's how common it is. Now, per se, hearing loss can be because of various reasons, right? And there are, if you look at it clinically, two types of hearing loss, and therefore the treatment differs. One is if only your external or middle ear is affected. Now that is a very common thing with Down syndrome. But that's because the functioning of the ear per se depends a lot on nose and the development of ear itself, right? And these children are known to have what we call as fluid inside the middle ear, right? So usually, every one of us has air inside the middle ear, which allows the sound to go inside. If you instead have fluid inside the middle ear, that sound does not reach where it is supposed to reach, and therefore these children have hearing loss, and it's a very, very common thing to have. Now let's say if I have this kind of a problem in my ears, or a young child who doesn't have Down syndrome have it, it might not be that big an issue, right? A very slight hearing loss many times is not that big an issue with others. With Downs it's a bigger issue, right? Because now the brain gets input a lot from eyes, as sir mentioned, and ears also help in that. So if the input goes down to the brain, the development starts getting affected very badly. So a slight hearing loss is a very important thing for these kind of children, and that can be easily taken care of. What I would say is, as per the government policy now, majority of hospitals are now supposed to do a hearing screening at birth. Sadly, it's not being followed everywhere, but that's what we aim for. So if that's being done at the hospital, the child would probably will come to know if there is any kind of hearing loss at birth itself. If it doesn't happen, we all have to take into consideration that even if we do not find any reasons that the child is having any hearing loss or not, do get it checked, right? It's of utmost importance, because we may miss it very easily, and then the condition they may progress further. So that's one. Hearing loss needs to be taken care of. That's something, if anybody of you has experienced, it's got drastic changes which can help in development. The second thing is, because ENT would involve the nose and throat as well. So after ear comes nose and throat, and these children are, if you look at the symptoms, they would have very commonly having cold. That would be nasal blockage, maybe having to breathe from mouth, snoring, these kind of things come in. And these are usually because of things which we normally consider to be important for our life, that is tonsils, and similar to tonsils, at the back of the nose we have things called adenoids. Now, many times we think that if they are enlarged, they would actually lead to these blockages of nose in the throat, not allowing the air from the nose to your chest, and therefore you have to breathe from your mouth. Right? This is what happens with these children because they are commonly having these issues. Many times we don't get them removed or don't get them treated thinking that they are important for immunity, but that's actually not true because an enlarged tonsil or an enlarged adenoid is not helping anything with the immunity. It's not functioning well now. It's a diseased tonsil or a diseased adenoid which needs to be taken care of. Now there are various medications. If they work out fine, if they don't, we need to get it operated. Right? That would help in 2-3 ways. One, it allows the child to breathe from the nose. Right? So all the air which goes into the chest is well filtered. It is not having a lot of infectious material. The chance of infection goes down. Secondly, these things also have an issue with functioning of the ears. Right? The hearing loss may actually be because of adenoids and tonsils. So that needs to be handled again. And once the children who get these surgeries or treatment done, the development per se improves. It's a very common thing that when adenoids and tonsils are taken care of by any kind of treatment, the development improves, the growth improves. So it's not just that taking care of 1 or 2 things here. This small disease can actually affect in a multiple way. So 3 things: hearing, enlarged tonsils and adenoids, which would actually give rise to cold, mouth breathing and snoring. Right? These are the common symptoms. Now when do you come to an ENT specialist? One, get the hearing checked regularly. It's starting at birth, then 6 months, 1 year, and maybe annually at least till 3 years of age. That's what the child needs. And if the child complains or you experience any hearing loss further, then it obviously needs to be followed up. Or secondly, if any time the child is doing mouth breathing, snoring, drooling of saliva, you need to see an ENT specialist there. Thank you. Yeah, same thing. If you want, I can talk in Hindi. So let me also, I and ENT are closely related. So I can talk in Hindi. Right? So if you look at it, डाउन सिंड्रोम के जो बच्चे हैं उनके 50 से 70% के अंदर हियरिंग लॉस मिलता है. सैडली वो चेक नहीं हो पाता है क्योंकि हम उसको यूजुअली चेक नहीं कर रहे हो, तो जब तक पता चलता है बहुत लेट हो जाता है. चेक करने के लिए वैसे तो भारत सरकार की पॉलिसी है कि बच्चे का पैदा होते ही हियरिंग का टेस्ट होना चाहिए. कई अच्छे हॉस्पिटल्स में हो भी रहा है, पर ज़्यादातर जगह अभी तक नहीं हो रहा है. अगर तो पैदा होते ही पता चल जाता है कि हमें बच्चे को सुनाई में प्रॉब्लम है, तो उसी वक्त इसका ट्रीटमेंट करा लेना चाहिए, क्योंकि जल्दी ट्रीटमेंट से बहुत जल्दी इसमें फ़ायदे मिल जाते हैं. तो सुनाई में कमी के कारण अगर बच्चा ज़्यादा सुनता नहीं है तो उसका बोलना, उसका पूरी तरह विकास होना थोड़ा सा डिले हो जाता है, क्योंकि ब्रेन को इनपुट जो जा रहा है वो कान और आँखों दोनों से जा रहा होता है. और अगर ये इनपुट किसी भी कारण से कम है तो डेवलपमेंट भी इफेक्ट होता है. तो पहली चीज़ है सुनाई, और ये सुनाई ज़्यादातर कम इसलिए होती है क्योंकि कान का जो बीच वाला हिस्सा है जिसको मिडल ईयर कहते हैं, उसके अंदर हवा होनी चाहिए, पर अगर उसके अंदर पानी जम जाता है किसी भी कारण से तो वो सुनाई जो आवाज़ है वो अंदर तक हमारे दिमाग तक नहीं पहुंच पाती है, तो सुनाई कम हो जाती है और विकास कम हो जाता है. दूसरी चीज़ जो डाउन सिंड्रोम के बच्चों में पाई जाती है वो होता है टॉन्सिल्स, और टॉन्सिल के जैसा एक टिश्यू होता है नाक के पीछे जिसको हम बोलते हैं एडिनॉइड. उन दोनों का बड़ा हो जाना. इस बड़े होने से क्या होता है कि जो सांस का हमारा रास्ता है, जो हवा नाक से होके छाती तक जा रही है, उसमें रुकावट आ जाती है. तो बच्चे को मुंह खोल के सांस लेना पड़ता है, उसको सांस लेने में तकलीफ़ होती है, खर्राटे आते हैं रात को सोते समय, और सोते समय मुंह से लार भी निकलती है. तो ये बहुत कॉमनली बच्चों में पाया जाता है, इनमें टॉन्सिल्स या एडिनॉइड्स बढ़ जाते हैं. बहुत ज़रूरी है कि इसको सही समय पे ठीक करा लें, क्योंकि इनकी वजह से छाती में इन्फेक्शन, सुनाई में कमी, विकास में कमी और बच्चे के ग्रोथ में कमी, ये सब चीज़ें टॉन्सिल और एडिनॉइड की वजह से हो सकती हैं. या तो अब जो हम कब दिखाना चाहिए, पहली चीज़ तो बच्चे का पैदा होते ही हियरिंग टेस्ट हो. हर बच्चे का होना चाहिए, डाउन सिंड्रोम में स्पेशली होना चाहिए, क्योंकि थोड़ा सा भी हियरिंग लॉस या सुनाई में कमी डाउन सिंड्रोम के बच्चों के लिए बहुत ज़्यादा इंपॉर्टेंट है एज़ कम्पेयर टू उन बच्चों को जिनमें कि डाउन सिंड्रोम नहीं है. अगर बच्चे का जन्म के समय सुनाई नॉर्मल है भी तो भी 6 महीने पे, फिर 1 साल पे और फिर 3 साल पे सुनाई का टेस्ट होना ज़रूरी है। टॉन्सिल्स और एडिनॉइड्स के लिए अगर किसी भी समय बच्चे को मुंह खोल के सोने की ज़रूरत पड़ रही है, वैसे मुंह खोल के बैठा रहता है, खर्राटे आ रहे हैं या मुंह से लार निकल रही है, तो अपने ENT स्पेशलिस्ट को ज़रूर दिखाएं, ताकि ये सारी जो मल्टीपल प्रॉब्लम्स हैं इस छोटी सी डिजीज़ से हम पूरी तरह ठीक कर सकते हैं। थैंक यू।
बहुत धन्यवाद डॉक्टर मोनीश मेरी सहायता करने के लिए।
Thank you.
और डॉक्टर मोनीश ने एक बात और कही है यहाँ पर, उन्होंने कहा है कि वो ज़्यादातर श्रवण बाधित बच्चों के साथ कार्य करते हैं जो कि सुन नहीं पाते, और यहाँ वो ऐसे माहौल में और ऐसे समारोह में पहली बार आए हैं, और डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के इस कार्यक्रम में आके उन्हें लग रहा है कि वो भी उन बच्चों के लिए कुछ ऐसा काम करें, ऐसा एक प्लेटफॉर्म बनाएं, तो ये हमारे लिए सम्मान की बात है। थैंक यू डॉक्टर।
थैंक यू सो मच।
Thank you, Dr. Monish. So we'll move on to the next specialist, Dr. Niti. She is heading Maximus Dental Care Hospital along with her husband, Dr. Anurag, based out of Delhi. They have a social initiative by the name of Smile Special, through which they cater the dental needs in children with special needs. Dr. Niti, when should they come for the first dental check?
Yeah.
And what are the general health advice related to the dental issues? What is preventive dentistry?
Yeah, I would request Dr. Nidhi to remember that question. Dr. Pradeep, I'm so sorry, I'll take a moment. This announcement was supposed to be after Devanshi's talk, but it was strategically delayed so that my friend and expert of DSFI takes one moment only to speak the entire thing she has to speak. So before our official dentists get to her talk, we call upon Dr. Surekha Ramachandran and Dr. Anurag. For the book launch, they have put their heart and soul to publish, and our dentist couple is on the stage, and they have worked closely with our community, and in the form of a book, they have published all the FAQs and the journal, and about all that book, you have all found that viral video Nidhi has posted few days back. Yes, Dr. Surekha Ramachandran, please help us. Yeah. And what a beautiful moment for our dentist couple that with our entire Humsafar family, they also have their one set of biological parents to share that moment with all of us. Thank you, Dr. Nidhi, Dr. Anurag, and Dr. Surekha Ramachandran. तालियां रुकनी नहीं चाहिए, क्या बात है, सो गए सब. Yeah, we request Ashi Gupta to be with us on stage. Yes.
Next 6 months we'll finish the thyroid book. Yeah, definitely. Very inspiring. We'll have very nice.
बहुत बहुत धन्यवाद आदरणीय मंच। डॉक्टर निधि, अब हम चाहेंगे कि आप
जी फॉरवर्ड पढ़ लेते हैं।
ओके।
This book has been, the amount of work that's gone into this book by both Anurag and Nidhi, my most beautiful children, who always work for the cause of our good teeth. So smile, everyone. We can never stress enough the importance of dental health and hygiene for persons with Down syndrome. I have believed in this for years. When Bubbly was born, I know exactly what we went through, because it was like, we never understood that we took it for granted that teeth would just come and it'll fall at the right time. It makes me very emotional when I realize that those days the dentist would say, it's okay, it will happen. But I really want you to understand that the teeth are such a crucial part of your child's development. None of us have realized we'll do everything. We'll go, and even the pediatricians will say, you can go. And now what we're doing is, even at birth, we're getting our children, the jawline and all that assessed. I shouldn't be telling what Nidhi is going to tell you, but these are very important factors. And we never realized it. It was so important when you say the child doesn't speak. Issues. Starting from right here, it's not always here. There are multiple things. So, I'm going to read out that persons with Down syndrome are known to have a lot of health issues, and the parents and caregivers can become overwhelmed. Am I right? We get very frightened with so many health issues, and not all states have a multidisciplinary team. So much so that the teeth as an issue comes at the bottom of the list. So it becomes essential to raise awareness about this aspect of health and educate not only the parents but also the medical community. This will help our self-advocates visit the medical professionals for treatment before the cavities and other dental problems. The key word in our case, is awareness. I'm thankful to Dr. Nidhi and Dr. Anurag for coming out with this absolutely much needed booklet that emphasizes oral health. I see this as a go-to guide on dental health that parents have been waiting for. This is the ready reckoner on dental issues that we have all been waiting for, and one that is sure to bring out the smiles. Thank you all so much, and let's all get a copy of this. Thank you so much, Anurag. Nidhi, God bless you, God bless you.
बहुत बहुत शुक्रिया रेखा माँ, बहुत बहुत शुभकामनाएं डॉक्टर निधि और डॉक्टर अनुराग को इस पुस्तक के लिए। डॉक्टर निधि मैं चाहूँगी अब आप डॉक्टर प्रदीप के सवाल से हमारे कार्यक्रम को आगे बढ़ाएं।
Yes. So I hope you all have teeth. If you have, you can give a big smile. I think that is the biggest form of gratitude you can give to DSFI and Rekha Ma for bringing this platform, bringing all the doctors together and addressing their concerns. So can I?
Yeah, they're smiling.
Thank you, thank you. So this question always comes, when should I take my child to the dentist? And we know it's very sad that the dental checkup actually doesn't come in anyone's mind, because we think that unless and until our children don't have teeth, we don't need to visit dentists, but actually it is a myth. So in children with Down syndrome, especially, we advise that you take your child at least at 6 months of age, not 6 years, please listen to me carefully, 6 months of age, or if possible, at least at 1 year of age, that can be his or her birthday present you can give to your child as the first step towards preventive dentistry. Now, is there any checkup you think is painful? No. We go to the dentist just for the regular checkup, and that forms the foundation for preventive dentistry. The dental checkups are not painful, dental treatments are painful. Preventive dentistry is not painful, dental neglect is painful, right? Am I making sense? So even before any tooth erupts in the mouth, you can take your child, get the expert opinion from the dentist regarding the jaw sizes, the shape of the jaw, if the child has tongue tie or the lip tie. The cleft lip and the cleft palate section is already covered when the child is born. So we need not worry about that. In most of the cases, it is already covered and taken care of. These are some of the issues. Your dentist can guide even, if the child is not able to suckle because of the tongue tie. The dentist can really help you. And the untying the tongue tie procedure will take just 5 minutes with the laser thing. So go to the dentist if you have very small kids. Go to the dentist even before they don't have any cavities, so that the sittings are not stressful, and it helps in making or building a rapport with the dentist. So actually I was going to present I had my presentation where I wanted all of you to be friends with your dentist, which is obviously against what you do. So if you don't brush your teeth, the dentist will give you the big injection. So what you do, you make villain dentist villain of all in your stories. Whereas I want you to make dentist an actor or maybe a co-actor in your stories. So don't say your dentist will give you injection, because subconsciously you are giving your child a fear which they don't know. None of the child is born with the fear. We make them fearful, right? So don't use these terms which you use, dentist will give you injection, or your tooth will need to be pulled out, or you have cavity, now the monsters will come. Don't say that. Simply say, we are happy, your dentist will be happy if you brush your teeth. So that the subconscious training goes in a positive manner. Now there are some guidelines as per to the preventive aspect. What I have already told, 6 months or the 1 year the first checkup should be done, so that the dentist can guide you about the correct brushing habits, about how to take care of the gum pads. The gum pads, if you stimulate them properly, they help in the eruption of teeth, they help in the chewing function, and they actually help in maintaining the stability of the lower jaw also in a very initial stage. Most of our children don't chew well. Most of the children don't chew well because of the bite issues, because of the laxity in the muscles around. And believe me, parents, we want them to chew well. If we just go to the basics, our chewing process is very complex. We have different set of teeth, incisors, the front teeth, which are used for cutting, then the cuspids, which are for tearing, and the molars are for grinding. But our children simplify the chewing process, which complicates the digestion process, right? When they complicate the digestion process, they land up with a lot of gastric issues. In our cases, we know how to chew our food. So if you chew, our process of chewing is very complex. If we chew it properly, our digestion is simple. So we have to take care and keep this in mind. The second thing is, when your child transitions to a school, a preschool or a formal school, beware of what you pack in the tiffin. Don't pack junk food, or even if you pack, keep at least a portion of fibrous food so that it helps in stimulation of saliva and flushes away all the retained particles inside the mouth. The third preventive strategy is, take your child not to the dentist, to the orthodontist around 8 to 10 years of age, because 99.9% of children with Down syndrome need palatal expansion, the expansion of the upper jaw. And I was speaking to Dr. Monish, palatal expansion does help an iota. It helps in the sleep apnea too. So please don't skip these guidelines, and when your child transitions into adulthood, you can think of correction of the bite, because bite will not correct itself. It will derange over a period of time, and there might come a time, not in all the children, but in some percentage where they may stop eating, they may stop speaking, because the orientation of upper jaw and the lower jaw is totally deranged. So these are some of the guidelines, and when should we visit the dentist, that also I have covered. Thank you.
डॉक्टर निधि कहती हैं, क्या आप सबके दांत हैं? हम सब रखते हैं, मुस्कान के लिए ये ज़रूरी है। सबसे पहले दांतों के डॉक्टर को बच्चे को कब दिखाना चाहिए? 6 महीने की उम्र में। वो कहती हैं कि याद रखें, 6 साल नहीं, 6 महीने की उम्र में पहली जांच होनी चाहिए। चेतनामुखी दांत जांच बुरी नहीं है, उपेक्षा करना बुरा है। जीभ के सही ना होने पर, यानी कि जीभ के ढीला जुड़े रहने पर या सख्त जुड़े रहने से भी दांतों का संबंध है, उसमें चबाने से और बोलने में अंतर पड़ सकता है, तो उसकी जांच भी होना ज़रूरी है। अपनी कहानियों में अपने बच्चे को डॉक्टर के पास ले जाने से पहले विलन मत बनाइए, उसे साइड एक्टर बनाइए। उसे ये मत कहिए कि डॉक्टर आके आपको इंजेक्शन लगा देगा अगर आप बात नहीं मानेंगे तो। और दर्द रहित दंत चिकित्सा उपलब्ध है, ये सच है, ऐसा होता है। दूसरी बात, चबाने में जो सही चबाने की काम जो सही से करने के लिए है वो है मसल्स का होना और जबड़ों के नीचे के हिस्से का सही होना। वो हमारे बच्चों को बहुत मुश्किल करता है, जिससे कि उन्हें चबाने में बहुत मुश्किलें आती हैं। चबाने में ये मुश्किल आने से पाचन की क्रिया जो है उसमें भी उन्हें बहुत समस्याओं का सामना करना पड़ सकता है। एक स्कूल जाने के समय में जंक फूड अपने बच्चे को लंच में पैक मत करिए, और अगर आप ऐसा करते हैं तो उसके साथ कुछ फाइबर का पार्ट भी उनके लिए ज़रूर रखिए। करीब 8 से 9 साल की उम्र में ऑर्थोडेंटिस्ट को अपने बच्चे को ज़रूर दिखाना चाहिए पैलेट के लिए, जो मुंह के ऊपर का हिस्सा है, तलवा है। इसके सही ना होने पर बच्चे की स्पीच पे बहुत फ़र्क पड़ता है और ये बहुत आसानी से सही किया जा सकता है, जिससे बच्चे का चबाना और बोलना दोनों अच्छे हो सकते हैं। ये प्रॉब्लम इतनी ज़्यादा होती है जबड़े की कि अगर बच्चे की ये सही नहीं होता है तो वो बता भी नहीं पाता है और उससे उसे चबाना और बोलना वो बंद कर सकता है। थैंक यू।
Thank you, Dr. Nidhi, for the wonderful explanation and also for this wonderful book, Dr. Nidhi and Dr. Anurag. We'll move on to the next specialist. So the next organ, I'm specifically telling you, this next organ we are going to deal with is your mind. So most of we don't know that mind is also as an organ, like thyroid, like your eye, like bones, like teeth. Mind is also is an organ, and it has to be managed if there is something wrong with the mind. And for that, we have our senior psychiatrist, Dr. Rangarajan sir from Chennai. So he will be dealing with all the issues related to mental health. Sir, what are the earliest signs a parent can pick up with related to mental health? Any issues, any deviations, how the parents will pick that up? What are the clues for the parents to identify that?
Thank you, Dr. Pradeep. And thanks, Dr. Eka, and old friends. We meet again every year, and I guess lots of faces are familiar, and I don't think I'm a stranger to this group too. And I'm saying the same things again too. Well, this organ, mind, is an invisible organ. Nobody can scan it. Nobody can X-ray it. So this is this invisible organ, but which seems to control every other visible organs. And like my friend earlier asked, this mild, moderate, severe kind of business. There's nothing like, the brain is there. So the mind is there. The body is there. So it doesn't mean just because your child is born with Downs, doesn't mean the child is a retarded child. It doesn't mean the child is going to be a vegetable, useless. Now, any child, as soon as a child is born, do you know whether the child is going to be smart enough to become a politician or stupid enough to be a psychiatrist? You don't know. The children develop in some way. Yeah. And none of us know in the beginning. The same way, here also we don't know. And what we're going to do is to play the game of understanding the child, go through various known problems like the vision or the dental or the nasal, the thyroid. We go through all that, we bring the children up, and as they grow, as they develop, we see how is the speed of development in this child as compared to the other children you see in the world, or compared to their own siblings. So there you see if there is a difference, then you got to figure out what this difference is. So this is something which organically happens as you keep bringing your child up. There's nothing like, when is this problem starting? So this is a very ordinary thing, and you figure out where, how to kind of teach or stimulate the child, and where to bring, or whether to send to school or to special education or some skills training. What you got to do is something you figure out as you spend time with your child growing up, just like with any other child. The only difference is every other child goes to pre-KG, LKG, UKG, da-da-do-do. Here, are we going to do the same thing, or are we going to kind of have a different approach? Okay. That apart, mental illnesses. These mental illnesses can happen to the Downs kids as much as it can happen to you and me and their siblings and everybody else, and the politicians too. Now, When, and the psychiatrist most important, they can also have mental illness. Now, when it happens, we don't know. How it happens, again, we don't know. But when it happens, we can make out some changes. And the change basically is difference from how somebody has been behaving over the past few months, few years, few weeks, etc. There can be changes which can be seen as early as an hour's time or a day's time or a couple of days, a week. But what I usually tell is, if you see a remarkable change in your child's behavior for more than 2 or 3 days, start observing. Maybe take the child to your pediatrician. And if the pediatrician says, you need to see a psychiatrist, please go ahead and see. Again, psychiatrist is not a villain, Not even a side actor, maybe even a comedian, but not a villain. Okay. The psychiatrist is not going to frighten the child or frighten you into thinking your child has gone mad. None of these things. Okay. We got to see, and we also don't know what's happening, isn't it? In my clinic, I'm led by the children's parents and the child. Because I got to hear the story. As I understand the story, then I see there is something happening here. I perhaps keep it against a template of somebody else, other children, and then a template of various mental health syndromes. So put it all in that perspective, and I see a pattern emerging. Then we start working on how to treat it, okay? I think that's where we start. And treatment process goes on. Medicines are there, counseling is there, psychotherapy is there, behavior therapy is there, occupational therapy. Depending on each individual situation, the treatment differs. There is very often a mix of various of these treatments, a combination which works for the patient. And most importantly, there is always the family. It's not like your child alone is going to be treated. The child gets, as the index care treatment. The parents important, the school is important, the siblings are important. The servant lady in your house is important, your driver is important. There are so many people who are involved in the child's care. Everybody in some way or other becomes important and relevant. And we work with all of them. Okay. Yes. Long story?
जी बिल्कुल छोटा कर देते हैं. डॉक्टर ने कहा है कि माइंड एक ऐसा हिस्सा है हमारे शरीर का जो दिखता नहीं पर होता है. हम इसे स्कैन नहीं कर सकते हैं, पर ये शरीर का एक बहुत महत्वपूर्ण हिस्सा है. डाउन सिंड्रोम से प्रभावित लोग नेता भी बन सकते हैं, उतनी भी काबिलियत रखते हैं, और एक साइकेट्रिस्ट बन जाने जितने नासमझ भी हो सकते हैं. स्पेशल ट्रेनिंग करते समय आप अपने बच्चों को जान सकते हैं. जब वो बच्चे स्कूल जाते हैं या स्पेशल स्कूल भेजते हैं या घर में आप उन्हें देखते हैं, तब आप उन पे नज़र रख सकते हैं. मानसिक रोग किसी को भी हो सकता है, मुझे, आपको या किसी को भी. इसे जानने के लिए कुछ महीने, कुछ साल या कुछ दिनों की भी आवश्यकता हो सकता है. उतने में भी आप इसे समझ सकते हैं. आप उस व्यवहार का पढ़ना शुरू करेंगे, साइकेट्रिस्ट को फिर दिखा सकते हैं, और उन्हें आप विलेन नहीं तो कॉमेडियन मान सकते हैं. मैं उनसे कोई कहानी सुनता हूँ, उन्हें बताता हूँ और उनका व्यवहार देखता हूँ. चीज़ों के बारे में उनकी बात कहने की या उनकी एक्ट करने की समझ को देखता हूँ, और तब जानता हूँ कि उन्हें क्या दिक्कत है. ये कोई बड़ी बात नहीं है. दवाई है, थेरेपी है, साइकोलॉजिकल काउंसलिंग है, जिनसे हम इन्हें ठीक कर सकते हैं. लेकिन सबसे महत्वपूर्ण है आपका परिवार, आपके बच्चे, दूसरे बच्चे, आपके परिवार के दूसरे मेंबर, और आपके घर की हेल्प, आपके ड्राइवर, आपकी दूसरी हेल्प. वो सब इसमें बहुत महत्वपूर्ण है. अपने बच्चे के साथ के लिए आप उनके साथ रहेंगे तो वो बिल्कुल इससे जल्दी ठीक हो जाएंगे. थैंक यू.
Thank you so much, sir, for this. You've emphasized on the importance of not just the index child to be examined or followed up by a psychiatrist, but the whole family may need some sort of support at some point of time during this journey. Thank you so much, sir. So we'll move on to the second round. After this second round, we'll take questions from you all. So in the second round, I'll move on to Dr. Prakash, sir. Sir, this is an era of rumors. all the rumors are spreaded in WhatsApp against vaccinations. So how important is to get these children vaccinated and the importance of prevention of major illness with the tool we have, the vaccinations? Please highlight on that.
Yeah. So how many of you in this auditorium, the parents, I would like to ask this question to you. Please raise the hands. Say, have you vaccinated your child for whatever the age it is? Can kindly please raise the hand. So I can see probably around 40% or 50% of hands raised. So what I would say is vaccination is one of the important things which you can easily get it done, and it is a preventive way. So the thing is, lot of parents have an kind of biased opinion about vaccination, or they probably are ignorant of getting vaccinated, or probably they missed out vaccination. What I would like to say is, vaccination is the one which can prevent most of the conditions, up to 90 to 95% of the illness, if a child could go through that during its growth. The common vaccinations has to be followed up from as early as from birth till 2 years. There are a lot of vaccinations, and the vaccination card which is given at the time of birth is what is the same vaccination card which you need to follow up. Now there are some other vaccinations as the child grows that has to be administered. So you need to ask your pediatrician which are the vaccinations which have been newly introduced. Now there are some issues in most of the hospital, like in cities, especially if you can't afford a vaccination. Equally, the vaccinations which are given in the corporate or a private hospital can be given in the government hospital. So kindly get the vaccination done, and that would definitely make a huge difference in your child's health, because you don't want your child to get some conditions which are preventable without getting vaccinations, and then you land up in a hospital with some issues. Now common questions which most of the parents ask is whether we should get the child flu vaccination every year, which is recommended highly, and kindly get the flu vaccination every year, preferably before the winter season starts, because this flu vaccination is more predominantly seen couple of months before the winter season starts. So kindly get all the vaccination done. Don't miss out, because this is one thing which is in your hand, and if you don't take proper vaccination at the right time, you probably land up with some viral infections which are not good for your child's growth and development. Thank you.
वैक्सीनेशन खास हैं, बहुत सारी बीमारियां हैं, 90 to 95% जिन्हें हम सही कर सकते हैं सही समय पर वैक्सीनेशन लेकर। जन्म से 2 साल तक सारी वैक्सीनेशन ज़्यादातर हो जाती हैं। जन्म के समय, वैक्सीनेशन के समय आपको एक कार्ड दिया जाता है जिसको आप बाद में भी फॉलो करते रहिए। अगर आप वैक्सीनेशन का खर्चा वहन नहीं कर सकते हैं तो बहुत सारे सरकारी और चैरिटी अस्पताल हैं जो ये करते हैं, वहाँ से आप ये करा सकते हैं, लेकिन ये ज़रूर कराना चाहिए। एक आम सवाल पूछा जाता है फ्लू वैक्सीनेशन के बारे में, तो फ्लू वैक्सीनेशन हर साल ज़रूर कराना चाहिए सर्दी से पहले, ये बहुत ज़रूरी है, नहीं तो आप इस तरह के वायरल इन्फेक्शन में जा सकते हैं।
Thank you so much, sir. And our endocrinologist, ma'am. So, is it only related to thyroid? The hormone issues, is it only related to thyroid? I heard Dr. Shankar telling about bone health, vitamin D, so that hormone and other hormones related to puberty. What are the roles? How should we follow?
So, thank you. First thing I want to say is puberty is not altered. Puberty is not altered in any way in children with Down syndrome. So the same age they'll start getting their periods around 12-13 years. For boys, you'll start noticing that the voice changes and they start developing a beard again around 14-15 years. So that isn't altered. So if you see a change, if you find irregular periods, if you think that the pubertal changes are either too early or too late, please talk to your pediatrician or come and visit an endocrinologist like me. So pubertal changes are at the appropriate expected age, and we should look for it, and it is normal. There may be as children are living longer, there may be a slightly higher incidence of early menopause. That is something we are just about beginning to understand. Maybe the periods stop by about the age of 40 years or 42 years, but that is a process that we are just about beginning to understand now. With regard to bone health, I think it's very important that we maintain good vitamin D levels in these children. In a growing age, vitamin D is very important for muscle strength. It's sometimes common to see that children are not able to walk properly or have difficulty crawling, which may be related to vitamin D deficiency. So checking the vitamin D levels and replacing, a lot of the pediatricians would be doing it. There is a lot of awareness about vitamin D. Our body's production of vitamin D is dependent upon the time that you spend in the sun. So ideally the sun's rays has to hit our body at close to 90 degrees, which means around 12 midday is ideal when the skin makes vitamin D on sun exposure. Now most of us are not going to be out in the sun at this time because it's going to be too hot, and also any clothing will cut out about 90% of the UV light, which is what is responsible for making vitamin D. So we have to be as much bare body as possible exposed to the sun, at least around say 10 o'clock, 11 o'clock. Just when you start to feel a burn in your skin, it means your body has made enough vitamin D. So definitely I think it's important for everybody, children and adults, to get adequate sun exposure, partly also for vitamin D production. If not, you can always give supplement and check it regularly, because it is important not only for bone health, it's also important for muscle health, it's also very important for immunity. There are studies showing that when vitamin D levels are low, it is associated with higher chance of frequent colds and cough. So vitamin D is very important for all of these reasons. And of course, as children get older, we also need to be screening them as we would for other things. Above the age of 18 or 19, in addition to thyroid, I say start looking at the metabolic factors, start looking at their sugars, cholesterol, blood pressure, and at an older age, routine screening for all these things related to. A lot of the children tend to be overweight unless physical activity and fitness is emphasized for all children from a young age. Because of the overweight, particularly gaining weight around the tummy area, they are more prone to what we call metabolic syndrome. So diabetes, cholesterol, blood pressure, a lot of the diseases that we associate with old age and aging happens because of this lack of fitness and weight gain. So please emphasize that from a young age in all of our children. So these are the most important things. At older age, remember to start screening for the metabolic parameters also at least yearly once.
वयस्क होना हमारे बच्चों में आम ही है, जैसे कि दूसरे बच्चों में होता है, और ये 13-14 के करीब बच्चों में उसी उम्र में आना शुरू होता है जिसमें दूसरे बच्चों को भी आना शुरू होता है. पीरियड्स आ सकते हैं, मूँछों के बाल आदि आ सकते हैं, और ऐसा होने पर एंडोक्रोनोलॉजिस्ट को दिखाना चाहिए. मासिक धर्म जो शुरू होता है वो 40 की उम्र पे ख़त्म हो सकता है नॉर्मल ही. हड्डियों की बीमारी विटामिन डी की वजह से हो सकती है. इसका सबसे अच्छा सोर्स जो है सूर्य की किरणें ही है, और ये सबसे अच्छा रास्ता है. सूर्य की किरणें 10 से 11 बजे के बीच में शरीर को लेनी चाहिए और सूरज में जाना चाहिए, और जब लगे कि शरीर जलने लगा है हल्का सा, तब समझना चाहिए कि आज का विटामिन डी पूरा हो गया है. और जांच कर अगर नहीं तब भी होता है तो सप्लीमेंट्स लेने चाहिए. कई बार विटामिन डी की कमी से हड्डियों के ही नहीं, ठंड और खांसी भी इसकी वजह से हो सकती है. और 18 वर्ष की उम्र के आसपास हमारे बच्चों के शुगर, कोलेस्ट्रॉल, ब्लड प्रेशर एंड विटामिन डी की रेगुलर जांचें होनी चाहिए, क्योंकि उसमें हमारे बच्चों का वज़न बढ़ने की समस्या हो सकती है, मोटापे की एक समस्या हो सकती है जो कि मेटाबॉलिक सिंड्रोम का उसका कारण बनता है. पेट के पास चर्बी बढ़ने लगती है जिसकी वजह से बहुत सारी समस्याएं विकास से संबंधित आ सकती है. तो मेटाबॉलिक सिंड्रोम पर भी और इस पर भी जांच बहुत ज़रूरी रखनी चाहिए.
Thank you. Thanks a lot, ma'am. So we'll move on to Dr. Rekhi. So while discussing about the ophthalmologic issues, is it only related to the vision? Do we need to know something else also? Other ophthalmologic issues that we should be aware of?
So I think there are certain other behavioral patterns that come out which are related to vision and the way we use our eyes. So for example, if you observe a child who's got a head tilt or a head turn, a face turn away to the left or to the right, most parents will end up saying, Seedha dekho, look straight. Please understand that it is not a comfortable position to turn your head to one side to be able to see. There is a reason the child is doing this. And the reason is it makes his vision better. So I'll give a simple story. There are some people who have this nystagmoid movement. It moves this way. Now, in most of these movements, there is something known as a null point. So let's say my eyes move this way. If my eyes move this way, my vision is going to be roughly 10% of normal. Okay? Now, let's say when my eyes are up like this, when I look up, this oscillation becomes less or becomes least. My vision will go from 10% to 60 to 70%. So this is a child who will talk to you and will say hello, and then if you say look at me or you show something, he will put his head down and talk to you. Now the problem is, this sort of a child, when it's a younger person, let's say 2 years of age or 2.5 years of age, when he's eating food, he has a plate which is put in front of him. Now how does he see the food? He has to put his head down. That's almost impossible to do. So what he does is, he pushes the plate away and now tries to eat. Now when he tries to eat from here, the food will drop. What do you think the mother does? She pushes the plate forward. This battle goes on 3-4 times, and then the child gets fed up and says, I will not eat. And the assumption is that the child is a poor eater. He doesn't know why he is pushing the plate away. The mother thinks that's the right approach because that is comfortable for you. It is not what is comfortable for the child. So whenever you see any behavior which seems to be different from yours, my sincere and strong advice to you would be, take a few photos, observe, send those pictures to your eye specialist. He may be able to give you some answers to it. I don't think we have the answers for everything, but quite often there will be a reason why the child is doing this. Do not discourage habits. There are children who will remove their glasses and read. I've got children who have got -7 who seem to be happier without their glasses. I don't have answers for it. Generally speaking, anyone with a power of more than -3 should at least wear the glasses to see something far away. I have kids who don't want to do it. And as specialists, we will always write at the bottom of the prescription for constant wear. So when the child removes the glasses, the parents tie it onto his head. So now his vision is not so good. We've made it worse. It's tied to his head, the spectacle, which has made it more uncomfortable, and he's irritated with you. How is he going to learn? Vision is important, but it's not as important as comfortable vision. I would rather sacrifice 10% of vision to give you comfortable vision. I think that's the biggest take home that I would say. हिंदी में बोल दूं? तो
जी मैं बोल दूँ। आँखों के लिए अगर आप एक बच्चे की आँख या चेहरा घुमाकर देखते हुए उसे देखते हैं कि वो अपना चेहरा या आँख घुमा रहा है, तो उसे कोई परेशानी है, वो ऐसा जानबूझकर नहीं कर रहा है। अगर वो ऐसा करता है तो आप उसका एक फ़ोटो लीजिए, अपने डॉक्टर के पास भेजिए। वो कहते हैं कि हमारे पास हर सवाल का जवाब नहीं है, लेकिन आपके बहुत सारे सवालों के जवाब हैं। और सबसे इम्पोर्टेंट है कि कंफर्टेबल होके देखना, ये ना कि एक सही विज़न देखना। हम सही देख पा रहे हैं इससे अच्छा है कि हम कंफर्टेबली देख पा रहे हैं। बाकी डॉक्टर एक आप कंप्लीट कर दीजिए।
और कुछ बोलूँ? नहीं, एक और जो चीज़ थी कि कई बार प्रिस्क्रिप्शन में लिखा रहता है कि कॉन्स्टेंटली पहनना है, हर वक्त चश्मा पहनना है। ये ज़रूरी नहीं है। उसका मतलब यही होता है कि हमारे समझ में ये चश्मे के साथ बच्चे को दूर की नज़र और नज़दीक की नज़र भी अच्छी रहती है। बट कई बच्चों में क्योंकि मसल आँखों का जो कोऑर्डिनेशन होता है वो कभी कभी जैसे मानो नज़दीक के लिए बच्चा चश्मा निकाल के पढ़ेगा, करने दो, मेरे को ऐसा कोई एतराज़ नहीं। या आप अपने डॉक्टर से पूछ लीजिए, वो चश्मा निकाल के कर रहा है, मगर रस्सी से मत बांधिए। अगर आप रस्सी से बांधोगे तो अभी जो भी कारण के लिए वो बच्चा चश्मा निकाल रहा था, उसकी नज़र तो ज़्यादा अच्छी हो रही है। अगर मैं आपको चश्मा दूंगा, आपको अच्छा नज़र आ रहा है, आप क्यों निकालोगे? तो उसकी चश्मा, आप बच्चों को समझो क्यों कर रहे हैं, उनको देखो क्यों कर रहे हैं ये चीज़ें, और वही आप डॉक्टर को रिपोर्ट कीजिए। फोर्स मत कीजिए। कभी कभी फोर्स करना अच्छी बात होती है, बट हर वक्त नहीं, 90% नहीं है।
धन्यवाद डॉक्टर रेकी। मैं कहना चाहूँगी पीछे थोड़ी हलचल शुरू हो गई है, आप लोगों से अनुरोध है कृपया शांति बनाए रखें, और कुछ भी खाने या पीने की वस्तुएं अगर आपके हाथ में हैं तो आप बाहर चले जाएं प्लीज़, वहाँ जाकर खाएं। थैंक यू।
थैंक यू सर। So we'll move on to Dr. Shankar. So what are all the treatment options available for orthopedic issues?
We see most of the orthopedic issues are related to lower limbs, legs. Like common things we come across are around the knees, like knock knees, kneecap moving outwards, or foot problems like big toe problem, smaller toe deformities, or commonly flat feet with the leg going outwards. These are all the common problems we come across. Apart from that, there are other issues we can come across around the hips, like hip subluxation resulting in difficulty in walking, or spine problems like bending of the spine called scoliosis. Sometimes children also can have a problem at the neck. We call it atlantoaxial instability. This is more relevant in children who participate in gymnastics or any major sports event, because any little bit of a movement will cause paralysis and it will be a risk to life. Apart from that, these things has to be investigated, because when a child is going for any surgical procedure, when an anesthetist is trying to lift the head, if there is an instability, again that will be a cause for a problem for the child's life. There is nothing to say that we can prevent all these issues. When it happens, we have to take it how we are going to treat it. Initially we can do physiotherapy to strengthen the muscles, or give a brace support so that the child can walk comfortably. Feet, like giving a proper footwear, arch support will help for the child to walk comfortably. Other than that, we cannot say surgery. We won't talk about the surgery here, because the surgery is only for the extreme cases. The common treatment is treating with the braces and special shoes. Sometimes children also can present with the scoliosis deformity, spine, bent spine. Even the normal children can get bent spine. So scoliosis is not a problem of only a child with the Down syndrome. But we see more incidence of scoliosis in children with the Down syndrome. Scoliosis will not cause any major problem unless it crosses more than 90 degrees. Otherwise, it's only a cosmetic problem. Whether you go for a treatment with a brace or a surgery is based on what your requirement is. Apart from all these issues, like we discussed about osteoporosis, sometimes children also can get painful joints, like a rheumatoid kind of a situation. If they develop those kind of a situation, it's better to consult a rheumatologist or an orthopedic surgeon to talk about the treatment. To have a normal, healthy life, we talk about vitamin D. Vitamin D alone is not enough. Vitamin D's function is to help absorb the calcium into the body. Whatever amount of calcium you take through the gut, if there is no vitamin D, calcium will not be absorbed. So vitamin D is important. Calcium is also as well, it's important. If a normal child requires about 500 milligram of calcium, growing children will need twice the dose, about 1 gram. Other than that, exercise. So calcium, vitamin D, and regular activities will help to strengthen the bone, which can improve the quality of life. So we talk about life expectancy. So the child is living for a long time into an adulthood. If they don't have a good quality of life, there is no use. So always you have to look at orthopedic issues and give importance to taking care of all those issues.
हड्डियों के रोगों में पैरों के नीचे के हिस्से के प्रॉब्लम जो हैं वो ज़्यादा होती हैं. कई बार जिम्नास्ट जैसे खेलों की वजह से मसल्स की बहुत सारी प्रॉब्लम हो जाती हैं. मसल्स का बैठ जाइए. मसल्स का अलग तरीके का मूवमेंट और उनका आपस में दम उनमें ना होना, ये इसका प्रॉब्लम हो सकता है. पैरों के ऊपर अलग तरह के जूते और ख़ास तौर पर फिजियोथेरेपी या फिर ब्रेसेस लगाकर इनको हम ठीक कर सकते हैं. कई बार मुड़ी हुई हड्डी की प्रॉब्लम भी के साथ भी कुछ केस होते हैं. सर्जरी या ब्रेसेस से इनको ठीक किया जा सकता है. रूमेटॉइड से जुड़ी प्रॉब्लम्स जो कि जोड़ों के दर्द हैं, उन्हें रूमेटोलॉजिस्ट को या बच्चों के डॉक्टर को इसके लिए जो अलग होते हैं उनको दिखाना चाहिए। असल में विटामिन डी का काम कैल्शियम को शरीर में शोषित करने का होता है। 2 बार 1 ग्राम की डोज बढ़ते हुए बच्चों के लिए विटामिन डी की ज़रूरी होती है। थैंक यू।
थैंक यू सो मच सर।
प्लीज़ शांति बनाए रखें, बैठ जाएं प्लीज़। थैंक यू।
Thanks a lot for the emphasis about the diet and also sun exposure and exercise. So we'll move on to our ENT surgeon. Sir, most of the time when we talk about this snoring, obstructive sleep apnea, tonsillar enlargement, adenoidal enlargement, these are some gray areas even for pediatricians. We don't know when to take decisions. Most of the time they'll get some upper respiratory illness, they'll have snoring, this will settle down over a period of time. But sometimes it may persist. When should we take the decision of go ahead with the surgery? And what are the benefits associated with doing a surgery at the right time?
I think that's a very important thing because we have a lot of myths about tonsils and adenoids and more so about their surgeries per se. Let me just clarify a few myths here. Tonsils and adenoids, are they important for immunity? You know, we think that if we get tonsils and adenoids removed, the immunity will go down. So one, if at all they are required for immunity, that's only in the initial 6 months to 1 year that adenoids or tonsils have any role in immunity. After that, their role is negligible. Secondly, especially if the tonsils and adenoids are enlarged, they are not functioning normally, they are rather giving you more problems and decreasing the immunity rather than helping out with any immunity. So there are two things which you need to remember. When do we operate? You know, that's what is important. Now, you know, the earlier times, maybe till 10 years ago, the major reason for surgery for tonsils and adenoids were repeated infections of the throat, that would be repeated tonsillitis, which would, you know, make us get the surgery done. Now that is almost a very, very rare thing to do because we have very good medicines which would take care of these things. So surgery for repeated tonsillar infection or tonsillitis is almost not done now, right? We don't require it. We need tonsils and adenoid surgery for something which Dr. Pradeep just mentioned and Dr. Nidhi also mentioned is obstructive sleep apnea. When the child is not improving from his or her complaints of mouth breathing, recurrent cold, snoring, drooling of saliva. Now these can be improved by a few things, right? You have medicines which are put in the nose, which we called as intranasal corticosteroids, which are given for 3 to 6 months period. Many of these children improve off. So if let's say if the adenoids are approximately 50% to 70% enlarged, many of these children would actually improve off, and this can be evaluated by various X-rays. However, if they are very significantly enlarged, especially with enlarged tonsils, especially with hearing loss, you don't wait for a long time, right? You don't want hearing loss to progress because that's something which will be more worrisome now. So if the child is, let's say, already 5 years of age with significantly enlarged tonsils and adenoids with even a minimal hearing loss, the indication for surgery are much more now. Vis-a-vis, let's compare it to a 2.5 or 3-year-old child who has only adenoids enlarged, but the tonsils are not that badly enlarged. The hearing is pretty much normal. I would preferably keep the child on medicines for at least 3 to 6 months to see if the adenoids can go down in size. If they do not, only then we do go ahead with surgeries. Now importantly, if we keep on delaying the surgeries, that's where the problem happens. Let's say 6-year-old child still doing mouth breathing, snoring, and we don't get surgeries done, then the patient's dental architecture goes bad, right? The facial contour goes bad. So now even if you remove the adenoids and tonsils after some time, the improvement will not be there. They will require multiple other things to be handled. If at all that would reach to a normal level, right? So you need to get it done early. Secondly, if you don't get it done, the ear or the chest will have some of the other issues. Ear would actually start discharging over time. You would have problems with the eardrum, the bones of the ears. The hearing would really go down bad. So there are very big implications of not getting this surgery done, right? And it's a very, very simple surgery. However, we need to realize the indications have to be clear. Medicines not improving, only then we actually go ahead with surgery, right? So this is what it is. Just, if you're okay, I can go ahead in Hindi. So टॉन्सिल्स और एडेनॉइड के बारे में कई चीज़ें हम ये मानते हैं कि हमारी इम्यूनिटी के लिए या कि हमें इन्फेक्शन से बचाने के लिए बहुत ज़रूरी हैं। अगर इनका कोई रोल है भी तो शुरू के 6 महीने या 1 साल की उम्र तक ही है। उसके बाद टॉन्सिल्स और एडेनॉइड का कोई रोल नहीं होता हमारी बॉडी में। स्पेशली अगर वो बड़े हुए हैं साइज़ में तो उनकी जो इम्पोर्टेंस है, उनकी जो ज़रूरत है हमारे शरीर को, वो और ज़्यादा कम हो जाती है, क्योंकि बड़े हुए टॉन्सिल्स या एडेनॉइड्स एक तरह से फंक्शन सही नहीं कर रहे हैं, तो हमारी इम्यूनिटी कम ज़्यादा करते हैं वो बनस्पत इसके बढ़ाने के। तो बड़े हुए एडेनॉइड्स और टॉन्सिल्स को रखने का कोई फ़ायदा नहीं होता। पर इसका मतलब ये नहीं कि हर बड़े एडेनॉइड्स और टॉन्सिल्स को निकालना ज़रूरी है। उनको हम तभी निकालते हैं जब बच्चे का मुंह से सांस लेना, खराटे लेना, रात को सोते समय बार बार उठ जाना, कई बार ये चीज़ें मेडिसिन के द्वारा ठीक नहीं हो रही हों। साथ ही में अगर बच्चे को सुनाई में परेशानी हो रही है तो हम बहुत ज़्यादा मेडिसिन पे वेट नहीं करते हैं, क्योंकि उसको फिर लंबे टाइम रखने पे कान की अंदरूनी चीज़ें ऐसी बदल जाती हैं कि वो सर्जरी के बिना बिल्कुल भी ठीक नहीं होती, और सर्जरी करने के बाद भी कई बार ठीक है, क्योंकि कान एक बहुत ही सेंसिटिव सी जगह है जहाँ पे थोड़े बहुत चेंजेस ही बहुत प्रॉब्लम कर सकते हैं। तो अगर एडेनॉइड्स और टॉन्सिल्स बड़े हुए हैं, साथ में सुनाई में कमी है, तो जल्दी सर्जरी करने की ज़रूरत है। स्पेशली अगर बच्चे की एज ऑलरेडी 4-5 साल को क्रॉस कर चुकी है तो जल्दी सर्जरी ज़रूरत है। अगर बच्चा अभी 2-3 साल का है तो हम मेडिसिन को आराम से 6 महीने तक काम में ले सकते हैं। अगर उन मेडिसिन से फ़ायदा नहीं हो रहा है तभी सर्जरी की ज़रूरत है। तो मतलब ये है इम्पॉर्टेंट बात कि ये नहीं सोचना चाहिए हमें कि एडेनॉइड टॉन्सिल निकालने से बहुत बड़ा नुकसान हो रहा है। आज के लिए डे केयर सर्जरी ऐसा है कि सुबह आके सारे बच्चे शाम तक घर चले जाते हैं, तो रात को रखने की भी हॉस्पिटल में ज़रूरत नहीं पड़ती है। सर्जरी काफ़ी सीधी है, समझना ज़रूरी है कि उसको लेकर डरने की बहुत ज़्यादा ज़रूरत नहीं है। जब भी मेडिसिन से हम इम्प्रूवमेंट नहीं आ पा रहा है, सर्जरी कराना बहुत सेफ है इसमें। थैंक यू।
Thank you, Dr. Monish. So the thing is, it is not like yes or no answer. It is not black or white. So these children needs follow up. We will regularly follow up depending on their age, depending on their immunity status. Based on that, the decisions are made. Most importantly, trial of medications, then if needed, surgery. So it needs a long-term follow-up. Then we will decide at one point of time when it has to be done. Thank you so much for highlighting that. Dr. Nidhi, what are the common dental abnormalities you see in your office practice, and what are the treatment options available?
एक मिनट डॉक्टर निधि, एक मिनट। रूपल से रिक्वेस्ट है वो प्लीज़ सफ़ायर 2 में चले जाएं। उनका बच्चा थोड़ा परेशानी में है, वो परेशान कर रहा है, मतलब आप प्लीज़ रूपल सफ़ायर 2 में चले जाएं। थैंक यू।
Okay, so the most common problems pertaining to dental we see is first is dental cavities. जो दांतों में कीड़ा लगना है वो हम अपने बच्चों में देखते हैं. The second is gum problem. So no one addresses the gum problem because our children hardly complain of pain and redness we don't see in gums. I think many parents who are nodding will definitely understand what I am speaking about. So जो मसूड़े की समस्या है, हम hardly we retract the upper lip or the lower lip in our child's mouth and see so many children have that red gums or swollen gums, and that gum part, the disease of the gum part, it goes down to the bone level, and what happens is suddenly the child loses tooth, and it is very common in children and adults with Down syndrome. So we have to be very mindful when your child is brushing his or her teeth or you are assisting your child, at least retract the lip or put some light, flashlight from the mobile or the sunlight. Just see the color of the gums. Normally it is pale pink. It is not dark pink. If it is dark pink or it is very red, so you need to consult your doctor, because the gum problems in children with Down syndrome may progress very rapidly. It may not give you time to intervene. Therefore, the regular follow-up with the dentist is very common. The other issue is the bite collapse, which I have already talked about. It may happen even in a child 5-year-old. Sometimes we think that our children will get permanent teeth by the time they're 12 years old. All the permanent teeth are in mouth. 12 साल का जब हमारा बच्चा हो जाता है, 10 से 12 साल का, तो सारे जो पक्के दांत हैं, परमानेंट टीथ है, उसके माउथ में आ जाते हैं. तब हमारे को लगता है कि शायद हमें डेंटिस्ट के पास जाना चाहिए, शायद इसके जबड़े की जो शेप है वो एबनॉर्मल है, बट तब तक हम ऑलरेडी लेट हो जाते हैं. वी आर लेट व्हेन वी आर आवर चाइल्ड इज 12 ईयर ओल्ड. So you should see your dentist at least when the child is 4 to 5 years of age pertaining to the bite issue. Because at that time we can do rapid maxillary expansion, the palate expansion, ऊपर का जो तालू है उसको हम खोल सकते हैं, बड़ा कर सकते हैं, and that will really solve 90% of the issues related to bite and speech. So mouth is an organ जो help करता है articulation में, it helps in articulation. I hope our speech therapist will be agreeing with me. So if there is abnormality in the palate, if it is high arch, there are so many sounds you cannot speak properly, or the lips are not closing, or the cheeks. So a visit to a dentist is must so that these issues can be tackled beforehand. One other issue which 3 parents have brought it into light very recently is a geographic tongue. I had never ever talked about it because I never saw it in my 10 years of this duration. But now 3 parents have come up and saying that their children are now showing signs of geographic tongue. So parents, please be careful when you help your child with brushing teeth, or whenever you see, just see the tongue also. It should not be very red, or it should not have, segregated patches, red or white, or any white lesion. You should see your dentist as soon as possible. The other thing which has also come up is oral ulcer. So, and I think in the last workshop which we had conducted with DSFI 2 weeks ago, we were talking about oral ulcers. The only thing I want you to keep in mind is if the oral ulcer persists more than 2 weeks and it is painless, you should consult your physician or the dentist as soon as possible.
ऊपर और नीचे के जबड़े और मुंह के अंदर की हिस्से की बनावट हमारे दांतों के लिए और स्पीच के लिए बहुत ज़रूरी है. यही डॉक्टर निधि फिर से बता रही हैं. जो पैलेट है, दांतों के ऊपर का हिस्सा है, उसकी गहराई, उसकी लंबाई, चौड़ाई को बदला जा सकता है एक ख़ास उम्र तक, और इसे बदलवाने के बाद उसके चबाने में, उसके बोलने में और उसके दांतों की हाइजीन को मेंटेन रखने में बहुत सहायता मिलती है, उसके पाचन में बहुत सहायता मिलती है. जियोग्राफिक जीभ की समस्या मैंने अपने 10 साल के करियर में कभी नहीं देखी, जो कि अभी कुछ 3 पेशेंट्स में मैंने ये देखा है. आप भी अपने बच्चों के दांतों की सफाई करते समय जीभ पे ध्यान दें. जीभ पे अगर लाल या सफ़ेद रंग के पैचेस, अलग अलग हिस्से बने हुए दिखाई देते हैं, तो अपने डॉक्टर को ज़रूर कंसल्ट करें. और पैलेट की समस्या को समय पर सही किया जा सकता है. इसे अगर हो सकता है तो ज़रूर सही कराएं. मुंह के छाले भी एक बड़ी समस्या है. अगर ये बार बार आपके बच्चे को हो रहा है तो प्लीज़ डॉक्टर से ज़रूर कंसल्ट करें. थैंक यू.
Thank you, Dr. Niti. Thank you, Dr. Niti. Sir, Rangarajan sir. So again, with related to psychiatric issues, most important, the mind block is stigmatization. Coming to a psychiatrist itself is they have that stigma in their mind whether to go to a psychiatrist or not. Next thing is when you prescribe a medication. So there are some apprehensions about taking psychiatric medications for that illness. So please explain